Today, we're going to be talking about Lyme disease with Dr. Corey Priest. What makes Lyme disease so challenging to treat?
People's systems are so stressed and taxed that uh, things like Lyme disease, Borrelia species are taking advantage of that weakened immune state, that hyper-inflamed state. And so spirochete type bacteria and associated co-infections, bacteria, parasites, viruses are taking advantage of that terrain of the individual that's in a compromised state, and it's actually starting to grow and manifest and do its thing. And then the replication process starts getting ahead of the immune system and what it can do to shut that response down. So it's just a culmination, the compounding effect of all the toxins, all the exposures, all the stressors that are happening to people now. Some of these latent, quiet, under the radar type infections are starting to get some teeth and grow. I think Lyme is something that's actually fairly easy to diagnose. You just have to know what tests to run and how to really kind of assess it physiologically and immunologically of what's really going on, and not necessarily just base everything off a CDC standard or an ILAS standard or something like that. You got to take the whole clinical picture into consideration, what the patient's presenting with. And so diagnosing it, I don't think is overly complicated. You just have to run the proper testing and ask the right questions and look at the clinical picture, and does it check off all these boxes? So the treatment part where that becomes difficult is figuring out the uniqueness of this and of the patient, and what can they tolerate, how long has it been going on, is there a consistent exposure source to it, is there toxic overload, how many other variables are actually contributing to this person's complication or concern or illness other than just this infection's hitting them. Do they have an overload of environmental toxins? Do they have an unhealthy relationship and just home life? Do they have an extraordinary amount of stress in their life that's just completely consuming them? Do they have bad dietary and lifestyle habits? I mean, there's so many variables there. And so where it becomes hard is if a condition of MSIDS or Lyme disease grabs a hold of somebody, it can pull you down pretty quick, and it can affect you mentally, emotionally, it can affect you physically, it can affect you physiologically, it can affect you energetically. I mean, there's so many variables of how it can affect you. And so how it affects each individual person really kind of relies on the constitution and resiliency of that individual. And so that's where the complication comes in, is what are the infections? What's the chronicity? What is the toxic overload? What are the other contributing pieces to this that are going on with this patient? And can we jump right into treating, or do we have to do a lot of prep work in order to get them to the point to where we can actually start treating them for that particular situation? And the other hard part is some people can be incredibly high functioning and not even know they really have Lyme disease, but they have weird things that just come on and off every so often, but Lyme disease is raging in them. And then you have the person who's totally debilitated, bedridden almost, if not totally bedridden, and their immune system isn't really responding. So there's not a lot you can do at this point, and we have to do a lot of other ground work in order to prepare them to move into that. Because if we go right into treating for things, sometimes it's too much for the system and they can get a lot worse. So there's so many variables to it. You just have to take the person as a whole and the situation as a whole to break it down and figure out really where's the starting point, and start walking them through that process and watching them very closely. It's not as simple as just here's an antibiotic, good luck. It's just not that simple. I wish it were, but it's not.
Excluding parts of their protocol that are individualized to their physiology and their personal needs, what does your treatment protocol for Lyme typically include?
To start, we always have to make sure that a person's drainage pathways are properly working. So we have to assess and analyze, how well is the person even ready to move into an approach to support the immune system to try to help calm down the Lyme situation and associated co-infections. So first step is we got to make sure drainage, clearing pathways, all that stuff is the lymphatics, all that stuff is working properly. The GI tract's working, all that kind of stuff. So that's critical step number one. Step two is then looking to see, is there a way to help modulate the immune response? So if we start going after this, but the immune system's unable to, if it's imbalanced in a certain way to where it can't actually produce the proper immune response, the person's going to get a little frustrated. And as providers, we'll get frustrated because they're not responding as we would typically hope. So trying to make sure that that immune system has the right tools and support and deficiencies are handled to where we can actually have a proper immune response is step number two. And again, I'm trying to simplify this in a nice way, and then the third step is developing, depending on the severity, the clinical presentation, and just everything that's involved, is developing a strategy to help arm and train the immune system to specifically go after these said infections, whether it's Borrelia, whether it's Bartonella, babesiosis, or Lichiosis, and the other vast number of associated co-infections that might be there. And oftentimes we have to, and we try to eliminate, not use any antibiotics, but sometimes we need to, especially in some of these hyper-compromised states. But so we can layer antibiotic in. We try to avoid any type of oral antibiotic and try to use IV approaches and things like that. And then what we're trying to do is also make sure we're treating enough of the infections, the different infections and co-infections at the same time, because if we don't treat enough of the co-infections or the associated infections, then you're never going to get ahead of that. So you're just constantly chasing these different infections and how the person presents. So how we go about that is through different homeopathic remedies, through different herbal approaches, through different therapies such as SOT, supportive oligonucleotide therapy. So with SOT therapy, what we're doing is we're really sequencing a technology or a mechanism called an antisense therapy. And for lack of better terminology, I try to explain it kind of like an enzyme. And so we actually, once we have identified that there's a antibody response or a positive situation with Lyme, meaning Borrelia or Bartonella or Babesia or any associated infections, Epstein-Barr, herpes, all that kind of stuff. What we'll do is then we will draw the person's blood and send it over to the lab in Greece that we use. And then we'll sequence and we send the lab report with it. And then what we do is they search for the RNA structure of that particular infection. And then they sequence an antisense for each individual infection. And what will happen is we will then receive that back from the lab, and we'll infuse it into the patient. That antisense therapy will link or bind to the middle portion of that RNA structure and cleave it apart. And then now you have a inert fragmented RNA structure that the body can clear out and not do anything. It doesn't do anything to the body, and then it releases it and then moves to the next RNA strand that it's constantly searching for. And the beautiful thing about this is it continues to work for about 4 to 6 months. So it's not a repeated therapy that we're constantly having to do every week or every day or every month. It's something that we infuse one time, let it do its thing while we do some other work training the immune system. And then in about 5 to 6 months, we'll reassess and see where we're at with that antibody response and the level of the infection and clinical presentation of the patient. There's a few infections that we're finding require 2 or 3 different SOT therapies, like Epstein-Barr, certain strains of Borrelia, that type of stuff. But everybody's so individualized, it's hard to say for sure how many SOT therapies are needed. I would consider it a big gun to help suppress a replicative process of these infections while we're training the immune system to deal with it, so we can actually allow the immune system to get ahead of the infection and keep it at bay and keep it in remission is the goal.
People at different places and reacting differently to Lyme. What was your experience like? Because you had Lyme, you said, right?
I'm still battling it. Well, I mean, I was pretty, I guess I would consider myself an incredibly high functioning person and never really put two and two together until um, this last year when just the right recipe hit me with high amounts of stress, an injury, um, and just the insult of a lot of things that were going on in the world at that time, through patient exposures to a whole host of things. And so, and just some genetic predispositions for certain situations. And it was enough of an insult in all these different areas that, certain things got flipped on. I have certain clotting factors that got flipped on. Certain inflammatory pathways got flipped on with me. And my inflammatory immune response got so suppressed that now when I look back on my life and look back through my childhood, specifically probably high school and college years, there was moments where mentally, emotionally, I would just feel totally fogged and spaced out, but I'd rebound. I was overall pretty healthy. I ate well, took care of myself, exercised a lot, collegiate athlete, but I've always been very prone to certain injuries, and have had some problems arise. And as I look back on it, I check off a lot of those boxes of potentially Lyme disease kicking in. But again, my constitution, my terrain was strong enough to suppress it down enough to where I didn't necessarily connect the dots until just recently. And I was forced to start peeling a lot of layers back to say, what's causing, my blood clotting issue out of nowhere? What's causing, my inflammatory markers, C-reactive protein, and just a number of other markers to just go through the roof when they've never been elevated before. And it didn't make sense as to why this was happening. And so when I started peeling layers back, I started looking for infections and stuff to see if that was it. And that's when I discovered, holy mackerel, I have multiple Borrelia species. I had babesiosis. I had streptococcal A and herpes strains. I had a whole host of different infections that were just hammering me all at once. And it's really affected my mood. It affected my cognitive abilities at times. My energy is definitely depleted. This whole inflammatory response situation that I've been struggling with, I finally got it quieted down, but it took a minute. Used a lot of SOT therapy, homeopathics, those types of things to help calm this down. But it's a process. It's not an overnight fix. But I can tell you without a doubt, the SOT therapies, I've tested and isolated those just by themselves, and those significantly helped get this thing to quiet down pretty quickly. And now using some other strategies is allowing me to help fully recover. So it's been a journey. It's not easy. And the mental piece behind it has certainly been challenging as well. So I can totally empathize with patients who are just spiraling down, spiraling out of control, lose hope, all that type of stuff. It's a real deal.